Hello, I'm Dr. Gerry Dembrowski, co-founder of the award-winning, patent-pending 20Lighter program. Welcome to Behind the Science of 20Lighter, how it all got started. The typical question I receive from 20Lighter patients or clients is, how does a doctor of chiropractic medicine become involved with weight loss? I've been in practice for about 20 years. What many people don't know is chiropractors are not just neck and back pain doctors. I have extensive experience in biochemistry and nutrition. In practice, this background has provided the opportunity for me to also work with people who had serious health issues. As my patients' health improved, they would ask, what can you do about my expanding waistline or my ever-increasing weight? I remember growing up how kids who had weight problems were ridiculed on the playground. Not only were they teased as children, but as adults, they've become the blunt of late-night TV jokes and sarcastic whispers from co-workers standing around the water cooler. Society has labeled people with weight issues as having a lack of self-control. Nothing can be further from the truth. Don't get me wrong, there are always exceptions to the rule. In my practice, the exceptions were few. Our patient intake form asks people to list 3 reasons why you must lose weight. Throughout the years, I can't tell you how many intake forms I've read. Many of those reasons would break my heart. So many people would write to improve my self-esteem, to feel better about myself, to not be depressed when I look in the mirror. Many of those same people would tell me, I don't understand what's wrong with me. I've tried everything. All I eat is lettuce, and I still can't lose weight. I've always known weight issues were more than just a number on the scale. It encapsulates many complex systems that interact physically, emotionally, and chemically. This is what is called holistic health care, or taking the whole body into account when taking care of a person's health. No matter what the disease, there are physical symptoms associated with it. There's also an emotional component to being sick. Suffering from any disease for any length of time isn't fun. The longer you're sick, the more it wears on you physiologically. With any disease process, there's also something that had to change your body's chemistry, allowing the disease to create symptoms. It's also important to note, physical illnesses can cause emotional issues and chemical imbalances. Emotional issues can create physical illnesses and chemical imbalances. And chemical imbalances can create physical illnesses and emotional issues. Weight gain and weight loss are only general terms. It only suggests the increase or a decrease in the number on a scale. It doesn't tell you if that increase or decrease is muscle, bone, water, or you weighed yourself earlier or later in the day. I prefer to call weight loss either fat storage or fat loss. It gives a much clearer understanding of what is changing. As I started to consider what others had created to combat the issue associated with weight loss, one thing became very clear. It's obvious weight loss wasn't about fat storage and fat loss. It was only about decreasing the number on a scale. Not one program addressed the fundamental causes of fat storage and fat loss. People don't accumulate fat because their body is deficient in powders, pills, bars, or celebrity-endorsed prepackaged foods. What the weight loss industry doesn't want you to know is inflammation plays a huge role in every disease process known to man. Everything from neck and back pain to heart disease, diabetes, cancer, and I can hear what you're thinking now. Yes, that includes fat storage and fat loss, and most importantly, visceral fat storage. The fundamental principle that inflammation is part of every disease process laid the groundwork for 20Lighter. This is where my holistic practice, combined with Dr. Jess's background in molecular neuroscience, brings an in-depth understanding of the neurological and molecular pathways that cause inflammation in the central nervous system and the gastrointestinal tract that causes visceral fat storage. This is what led to the fine-tuning of the 20Lighter program. Now we understood the cause of visceral fat accumulation. Now we can address specific areas affected by the inflammation. This is what led to the 20Lighter program being invited to present peer-reviewed clinical data at prominent scientific and medical conferences around the world, and the award-winning data presentation at the 2016 14th World Congress on Insulin Resistance, Diabetes, and Cardiovascular Disease. The facts are, anyone or any program can cause you to lose weight. Weigh yourself at a different time throughout the day, work up a sweat exercising, or walk around the block, or up and down a few flight of stairs. Drink more or less water. You'll change the number on the scale doing all of them. What you'll want to do is change the number on the scale because you're losing fat, and more importantly, because you're losing visceral fat, not because your body is burning water, carbohydrates, or proteins, or you took your shoes off. The 20Lighter program is the only patent-pending visceral fat reducing program in the world. That is why we're invited to present peer-reviewed clinical data around the world. That's why the 20Lighter program won the award at the 2016 14th World Congress on Insulin Resistance, Diabetes, and Cardiovascular Disease. It wasn't because we created a new powder, pill, bar, or celebrity-endorsed prepackaged meal plan. It was because science and holistic medicine devoted their hearts, minds, and souls to improving the quality of life of those suffering. And amazing things started to happen. The 20Lighter program is the only program ingrained in science and incorporates natural strategies to address inflammation in the central nervous system and gastrointestinal tract, leading to visceral fat accumulation, the fundamental causes of fat storage, fat accumulation after weight loss, and metabolic diseases associated with visceral fat storage. There isn't a magic bullet that will cure the things that are making you sick, overweight, or obese. It will require work, discipline, and commitment to the most important person on the planet, you. Thank you for taking the time to listen. This is Dr. Gerry Dembrowski, co-founder of the patent-pending, award-winning 20Lighter program. For more information on how the 20Lighter program helps combat dietary inflammation, please visit our website at 20lighter.com, Facebook, YouTube, Instagram, or Twitter. You can also learn more about the causes of dietary inflammation by listening to my 3-part podcast on dietary inflammation. Thank you for taking the time to listen.